Have you ever woken up in the morning and felt like your knees just don't want to move? That first step out of bed feels stiff, painful, and slow. And as the day goes on, it only gets worse. Do stairs feel like mountains, making you hesitate before every step? Do long walks seem impossible, even though you used to enjoy them so much? If this sounds familiar, you're not alone. Millions of seniors experience knee pain every day, and for many, it feels like a life sentence. But here's the good news: there are real, effective ways to reduce knee pain, strengthen your legs, and regain your mobility. Let me share a real-life story. Meet Mr. Robert, a 68-year-old retiree who loved gardening. It was his passion, his therapy. But over time, knee pain forced him to give it up. The bending, the kneeling, the simple act of standing up, it all became too painful. His doctor recommended surgery, but Robert wanted to try natural methods first. That's when he discovered a simple list of do's and don'ts, small changes in his daily habits that transformed his knee health. And guess what? Within months, he was back in his garden, pain-free. No surgery. No expensive treatments. Just the right habits. And in today's video, I'm going to share these same 11 do's and don'ts with you. These scientifically backed strategies will help you reduce knee pain naturally, strengthen your leg muscles, restore your mobility so you can walk, climb stairs, and enjoy life again. If you've ever struggled with knee pain, comment yes below. Let's support each other and take the first step toward pain-free knees. As we age, many people assume that knee pain is just an unavoidable part of getting older. But what if I told you that's only half the truth? While aging plays a role, the real reason your knee pain is getting worse is because of three key factors: cartilage breakdown, inflammation, and weak muscles. Let's break them down in a simple, easy-to-understand way. 1. Cartilage breakdown: less cushioning, more pain. Your knees rely on cartilage to act as a cushion between the bones. Over time, this cartilage wears away, leaving the bones to rub against each other, causing pain, stiffness, and even swelling. The good news: certain foods, like leafy greens and bone broth, contain collagen and vitamin K, which help slow cartilage breakdown and keep your joints strong. 2. Inflammation equals more swelling and stiffness. Ever wake up and feel like your knees are swollen, stiff, and just won't bend properly? That's because inflammation is making the joints irritated. Now, here's something most people don't know: the wrong foods can actually make inflammation worse. Refined carbs, fried foods, and too much sugar cause your body to produce inflammatory chemicals, which can make knee pain unbearable. The good news: switching to an anti-inflammatory diet with omega-3 rich fish, nuts, and turmeric can help reduce knee pain naturally. 3. Weak muscles equals less stability, more strain on your knees. Strong leg muscles support and stabilize the knee joint. But if these muscles become weak, the entire knee takes on extra strain, making movement painful and difficult. Solution: doing simple strength-building exercises like seated leg lifts or gentle squats can improve stability and help you move with confidence again. Real-life example. Mrs. Linda ignored her knee pain for years, thinking it was just aging. But once she started focusing on strength-building exercises and an anti-inflammatory diet, she noticed a huge improvement. After a few months, she could walk her dog again without pain. Engagement prompt: which of these three factors affects you the most? Comment 1 for cartilage breakdown, 2 for inflammation, or 3 for weak muscles. Knee pain doesn't just appear overnight, it builds up over time due to bad habits that most people don't even realize they're making. Today, I'll expose 5 common mistakes that make knee pain worse and how you can fix them to stay active and pain-free. 1. Don't rest too much. Weak muscles equals weaker knees. Why is this a mistake? Many seniors believe that resting their knees all day will help them heal. But in reality, too much rest leads to muscle atrophy, wasting away of muscle tissue. The quadriceps, hamstrings, and calf muscles support the knee joint. When they weaken, the knee is forced to take on more stress and pressure, increasing pain. Scientific explanation. Studies show that muscle loss begins after just 2 weeks of inactivity, making joints less stable. A weaker knee joint is more prone to injury, stiffness, and long-term arthritis. How to fix it? Perform gentle, low-impact exercises like seated leg lifts, walking, or swimming to maintain muscle strength. Avoid staying seated for long periods. Stand up and stretch every 30 to 45 minutes. 2. Don't ignore your weight. More weight equals more knee stress. Why is this a mistake? Every extra 1 pound of body weight adds 4 pounds of pressure on your knees. This means that being 10 pounds overweight adds 40 pounds of extra stress every time you take a step. Scientific explanation. Excess weight accelerates cartilage breakdown, increasing the risk of osteoarthritis. A 2022 study in the Journal of Orthopedic Research found that losing just 5% of body weight significantly reduces knee pain in arthritis patients. How to fix it? Focus on nutrient-dense foods like lean proteins, vegetables, and whole grains to promote weight loss without muscle loss. Start with light daily movement, such as 15-minute walks, to burn calories and strengthen knee-supporting muscles. 3. Don't wear the wrong shoes. Poor support equals joint misalignment. Why is this a mistake? Wearing flat sandals, high heels, or unsupportive sneakers increases stress on the knees by changing your walking posture. This misalignment forces uneven pressure on the knee joint, leading to pain, swelling, and even long-term damage. Scientific explanation. Poor footwear alters the biomechanics of walking, making knee joints absorb more impact. A Harvard Medical School study confirmed that properly cushioned footwear reduces knee stress by 20%, easing arthritis symptoms. How to fix it? Choose shoes with good arch support and cushioning. Look for orthopedic options if necessary. Use shock-absorbing insoles to minimize pressure on the knee joint. 4. Don't do high-impact exercises. Too much pressure on knee joints. Why is this a mistake? Many people believe more exercise is always better, but high-impact activities like running, jumping, and deep squats actually worsen knee pain by increasing wear and tear on the joint. Scientific explanation. High-impact exercises produce excessive joint compression, leading to faster cartilage erosion. Studies show that low-impact activities like swimming or cycling reduce inflammation while strengthening muscles around the knee. How to fix it? Swap running for brisk walking, swimming, or cycling, which are joint-friendly exercises. Avoid deep lunges, full squats, and jumping exercises, which put too much pressure on the knees. 5. Don't skip stretching. Tight muscles pull on your knees. Why is this a mistake? Skipping stretching causes muscle tightness, which pulls on the knee joint and reduces flexibility, making movement stiffer and more painful. Scientific explanation. Tight quadriceps and hamstrings increase strain on the patella, kneecap, leading to more pain. A study in the Journal of Physical Therapy found that daily stretching improves knee mobility by 30% in seniors. How to fix it? Perform gentle knee stretches every morning and evening. Focus on hamstring, quadriceps, and calf stretches to improve flexibility and relieve knee tension. Final takeaway. Knee pain doesn't have to take over your life. Avoid these 5 common mistakes, and you'll feel less pain, more strength, and better mobility. Engagement prompt. Which mistake have you made before? Comment 1, 2, 3, 4, or 5 below. Knee pain doesn't have to be permanent. The truth is, simple daily habits can make a massive difference in reducing pain, strengthening your knees, and keeping you active for years to come. Today, we'll go over 6 essential daily habits that will help you reduce knee pain, improve flexibility, and protect your joints from further damage. These habits are backed by science and used by people who have successfully managed their knee pain naturally. 1. Do low-impact exercises. Walking, swimming, and cycling improve knee strength without strain. Why is this important? High-impact activities like running or jumping can wear down your cartilage faster, while low-impact exercises strengthen the knee without adding stress. Research shows that 30 minutes of low-impact exercise daily can reduce knee pain by up to 40%. What to do? Try walking on flat surfaces, swimming, or using a stationary bike for gentle movement. If walking is too painful, start with 5 to 10 minutes a day and gradually increase. 2. Do use the Rice method. Rest, ice, compression, elevation, helps reduce swelling. Why is this important? When your knee swells due to overuse or injury, inflammation can limit movement and cause long-term damage. The Rice method, rest, ice, compression, elevation, helps reduce swelling, speed up healing, and relieve pain. What to do? Rest, avoid straining the knee but continue gentle movements. Ice, apply an ice pack for 15 to 20 minutes, 3 to 4 times a day to reduce swelling. Compression, use a knee brace or wrap to prevent excessive swelling. Elevation, when sitting or lying down, keep your knee raised to improve circulation. 3. Do hydrate and eat joint-healthy foods. Water plus omega-3 foods keep joints lubricated. Why is this important? Water acts as a natural lubricant for joints, keeping cartilage hydrated and healthy. Omega-3 fatty acids found in fish, nuts, and flax seeds reduce inflammation and protect knee cartilage from further wear and tear. What to do? Drink at least 8 glasses of water daily to keep joints lubricated. Eat omega-3 rich foods like salmon, walnuts, and chia seeds to fight inflammation. 4. Do strengthen leg muscles. Stronger muscles reduce stress on your knee joints. Why is this important? The quadriceps, hamstrings, and calf muscles play a crucial role in supporting the knee. Weak muscles equals more pressure on your joints, leading to more pain. What to do? Try seated leg lifts, wall sits, and resistance band exercises to strengthen your legs. Even 5 minutes a day can significantly improve knee stability and reduce pain. 5. Do get enough vitamin D. Sunlight helps absorb calcium for stronger bones. Why is this important? Without vitamin D, your body can't absorb calcium properly, leading to weaker bones and a higher risk of knee injuries. A study found that 50% of people with joint pain were vitamin D deficient. What to do? Get 15 to 20 minutes of sunlight daily, morning or late afternoon is best. Eat vitamin D-rich foods like fatty fish, eggs, and fortified dairy products. If needed, consider a vitamin D supplement. Consult your doctor first. 6. Do consider acupuncture or massage. These methods relax tight muscles and improve circulation. Why is this important? Acupuncture stimulates specific points in the body, helping to reduce knee inflammation and relieve chronic pain. Massage therapy improves circulation, allowing more oxygen and nutrients to reach the knee joints. What to do? Try acupuncture sessions with a certified specialist to see if it reduces pain. Use a massage roller or self-massage techniques to relax tight leg muscles. Final takeaway. Knee pain is not just about aging, it's about habits. By making small daily changes, you can reduce pain, strengthen your knees, and improve your mobility for years to come. Engagement prompt. Which of these 6 daily habits will you start today? Comment 1, 2, 3, 4, 5, or 6 below. Knee pain doesn't just come from aging, it comes from daily habits. The good news. Small, daily changes can make a big difference in reducing pain and strengthening your legs. So before we wrap up, here are 3 powerful lifestyle habits that can help you keep your knees strong, flexible, and pain-free. 1. Try daily knee strengthening exercises. Just 5 minutes a day can transform your leg strength. Why is this important? Your knee joints rely on strong muscles for support. Weak muscles equals more strain, more pain, and higher risk of injury. Research shows that just 5 minutes of daily strengthening exercises can improve knee stability and reduce pain by up to 30%. What to do? Seated leg lifts, sit on a chair, straighten one leg, hold for 5 seconds, then switch. Heel and toe raises, stand up, lift your heels, then lower. Repeat with toes. Wall sit, modified, stand against a wall, slowly slide down a little, hold for a few seconds. Pro tip, doing these before bed or in the morning can improve mobility and reduce morning stiffness. 2. Stay hydrated, your joints need water to stay lubricated. Why is this important? Think of your joints like a sponge. Without water, they dry out and become stiff and painful. Cartilage is 80% water. If you're dehydrated, your joints won't function properly. What to do? Drink at least 6 to 8 glasses of water per day. If you drink coffee or tea, increase water intake to balance out dehydration. Try adding lemon for an extra boost of vitamin C. Pro tip, if your urine is dark yellow, you need more water. 3. Get enough sunlight, vitamin D keeps your bones strong and pain-free. Why is this important? Vitamin D helps absorb calcium, which is essential for strong bones and healthy joints. 50% of people with joint pain are vitamin D deficient. What to do? Get 15 to 20 minutes of sunlight daily, morning sun is best. Eat vitamin D-rich foods like salmon, eggs, and fortified dairy. Consider a supplement if you don't get enough sun, ask your doctor first. Pro tip, if you feel constant fatigue and joint pain, you might need more vitamin D. Quick story. A senior patient of mine struggled with knee pain for years. She started following these 3 simple habits daily, doing 5-minute exercises, drinking more water, and getting a little sunshine every morning. Within a month, she noticed a huge difference. Now, she moves with confidence and no fear of knee pain. Engagement prompt. Which of these 3 habits will you try first? Comment 1 for exercise, 2 for hydration, or 3 for vitamin D. You've made it to the end of this video, and that means you're serious about improving your knee health. But before we wrap up, let's quickly go over what we've learned today. Quick recap. Avoid bad habits that cause inflammation and weaken joints. Follow the right habits to strengthen your knees naturally. Consistency is key, small daily changes lead to big results. The science is clear. The foods you eat directly impact joint health. Exercise is essential for knee stability and pain reduction. Hydration and vitamin D play a crucial role in joint flexibility and bone strength. So, what's the takeaway? You don't have to live with knee pain forever. The power is in your hands to improve your mobility, reduce pain, and live an active life again. Final motivation. You have the power to take control of your knee health. No more suffering in silence, take action today. Even small steps, like walking for 10 minutes or drinking more water, can transform your knee health over time. Your knees carry you through life, treat them with the care they deserve. Stay consistent, stay strong, and keep moving forward. Call to action, CTA. Which habit will you start today? Type 1 for exercise or 2 for hydration. Want my free knee pain relief guide? Comment your email below. If this video helped you, share it with a friend who needs it. And don't forget, hit subscribe so you never miss out on expert health tips to keep you active and pain-free.